Aortic regurgitation. This murmur is a high-pitched, diastolic, decrescendo murmur that is heard along the left sternal border. Listen to a patient with aortic regurgitation. I will start with 3 normal beats and then add the murmur. This murmur reflects flow backwards through the aortic valve during diastole. This murmur is usually heard best in the 3rd or 4th left intercostal space with the patient leaning forward. Aortic regurgitation can be seen by color Doppler echocardiogram, and the severity can be estimated by the width of the jet in the left ventricular outflow tract. Typically, a pulse pressure greater than 100 millimeters of mercury accompanies significant aortic regurgitation. Aortic regurgitation can be increased by having the patient tighten both fists. The increased aortic pressure makes this murmur easier to appreciate. First, at rest, and now with hand grip. Aortic regurgitation can occur in patients under the age of 35 with a bicuspid aortic valve. This murmur is sometimes faint and can be missed if the clinician does not listen to the chest with the patient leaning forward and the breath held in expiration. If aortic regurgitation is heard to the right of the sternum, then aortic root pathology, such as an aortic aneurysm, should be suspected. According to the American College of Cardiology guidelines, in asymptomatic patients with severe aortic regurgitation, serial echocardiograms are recommended to assess any progression towards the need for surgical replacement of the valve. In summary, the murmur of aortic regurgitation is a diastolic, decrescendo murmur which is high-pitched in character. This murmur is heard best in the third or fourth left intercostal space. Listen once again to a patient with aortic regurgitation.